In a startling move, Mississippi health officials have declared a public health emergency due to a troubling rise in the state's infant mortality rate, particularly affecting Black infants. This declaration, made by the Mississippi State Department of Health, comes in light of alarming statistics that reveal 2024 has recorded the highest infant death rate in over 10 years. The data paints a stark picture. While the mortality rate for white infants has reached one of its lowest points in the past decade, the rate for Black infants has surged to unprecedented levels. In fact, nearly twice as many Black infants lost their lives compared to their white counterparts last year, highlighting a significant racial disparity that cannot be ignored. Mississippi, known for being one of the poorest states in the U.S., has historically struggled with high infant mortality rates. However, the recent escalation in these figures, coupled with the widening racial gap, has prompted urgent action, according to State Health Officer Dr. Daniel Edney. "It hasn't been this bad in a long time," Edney remarked in an interview with Mississippi Today. Despite the concerted efforts from many of us and various partners across the state, the statistics indicate a significant decline in outcomes. Honor McDaniel Hill, who directs infant and maternal health initiatives for March of Dimes, noted that such a declaration of a public health emergency is rare among states dealing with infant mortality. She described it as an interesting tactic that reallocates time, energy, and resources towards addressing this critical issue. What this emergency status does is elevate the situation, allowing the state health department to prioritize funding, personnel, and attention to this urgent cause. McDaniel Hill explained. It effectively breaks down barriers that have previously hindered progress. Dr. Edney expressed hope that this emergency declaration would expedite the development of a new care system, aiming to implement it 6 months sooner than initially planned. This new OB system of care, which has been in development since 2023, will categorize birthing hospitals based on their care capabilities, a strategy known as perinatal regionalization, which is already in use in several other states. Additionally, it will enhance transportation and tracking systems to ensure that high-risk mothers can be transferred more efficiently. Edney is optimistic about designating hospitals as early as October, although the complete rollout of this system may still take a couple of years. Furthermore, he plans to expand perinatal services at county health departments in regions identified as obstetric deserts, as part of a comprehensive strategy to tackle this emergency. According to McDaniel Hill, nearly half of Mississippi's counties lack adequate maternity care, and these areas account for almost a quarter of the state's births. Therefore, improving access to care is a crucial element of the solution. The Mississippi State Health Department has also outlined additional strategies in their press release, which include increasing staffing for a home visitation program called Healthy Moms, Healthy Babies, and educating families about safe sleep practices to reduce the risk of sudden infant death syndrome, a leading cause of infant mortality in the state. The latest report card from March of Dimes for Mississippi included several policy recommendations that the legislature would need to address, such as expanding Medicaid to cover working individuals with modest incomes, a proposal that faces opposition from Republican Governor Tate Reeves. Notably, the health department did not mention Medicaid expansion in their emergency response plan. Monica Stinson, the Senior Program Director of the Mississippi Perinatal Quality Collaborative, emphasized that her organization will play a pivotal role in the emergency response by collaborating with community organizations and connecting families to essential resources. This declaration serves as a powerful tool to centralize resources, align key partners, and eliminate barriers that have historically impeded progress, Stinson stated. This formal acknowledgement of the crisis enables us to move beyond fragmented efforts and work towards a more coordinated, statewide strategy aimed at improving outcomes for all mothers and infants in Mississippi. What do you think about the measures being taken in Mississippi? Do you believe declaring a public health emergency is an effective way to address such a critical issue? Share your thoughts in the comments.